Good afternoon. My name is Mrs. Johnson. This is an introductory course for the pre-licensed nurse for a head-to-toe assessment. This is for NUR 6660. The objective of this course is by the end of this presentation, the pre-licensed nurse will have an understanding of the review of systems included in the head-to-toe assessment. The head-to-toe assessment is a very essential nursing function. Assessment is the first key to the nursing process, and the assessment is the process that all other nursing intervention and evaluation are built upon. So we have a pretend patient who's going to be in the room. We're going to go through the systems, head-to-toe assessment, and then we'll get started in just a moment. First thing we're going to do is leave the station. I'm going to go and I'm going to wash my hands. If I hadn't disinfected my stethoscope, I would also do that at that particular time to prevent the spread of germs. I'm going to go back over here. Sorry for the back and forth. Turn the water off. We can start that. Okay.
Come in.
Well, good morning.
Good morning.
How are you today?
Good.
My name is Miss Johnson. I'm going to be your nurse today from 7 a.m. to 7 p.m. Can you tell me what your name is?
Bill.
Well, hey, Bill, it's nice to meet you. Can you tell me where you're at?
The hospital.
You're in the hospital. That is correct. Do you know what the year is?
2014.
Okay. And who might be the president?
Obama.
Are you sure?
Yes, ma'am.
Yes, he is. Okay, so what I'm going to do is, Mr. Bill, I'm going to look you over from head to toe, and I'm going to compare that to how some of your other assessments have been, and we're going to make some notes on the chart, okay?
Yes, ma'am.
Do you have any questions?
No, ma'am.
Well, how did you sleep last night?
Good.
Did you? Are you hurting anywhere?
No, ma'am.
Okay. So, I like to interact with my patient. And have a series of conversation. That way, that'll give me an opportunity to assess neurological function without actually having to assess the neurological function. It can give you some other input. So I'm going to start at his head. The first thing I want to do is look at his hair distribution. Of course, it's going to be for age. You have to consider age appropriateness. His hair is evenly distributed. And then I'm going to be looking at his head for any types of lesions or bruises or any contusions, and there aren't any. So as we go down, we're going to be looking at his eyes. Would you remove your glasses for me, Mr. Bill?
Yes, ma'am.
I'm looking at his eyes. I want to make sure of the color, to make sure that it's a good color, that it's white and that it's clear, it's not red, it's not jaundice. And want to make sure that there's not any eye wandering, that he can move them. Move your eyes this way, that way, go up, go down. Okay, want to make sure that he can follow. And that also assesses his ability to follow commands. Here, as I look at his ears, I'm going to be looking to make sure that there's not any drainage or anything. Are you having any trouble hearing?
No, ma'am.
Any ringing in your ears?
No, ma'am.
Okay, what about any trouble seeing?
No, ma'am.
Okay. As I come down to his nose, I'm going to be making sure that his nose is in the middle of his face, that it doesn't deviate from one way to the other. And then I'm going to be looking and making sure that there's not any redness or any drainage. I can put my finger here and you can feel that he does have air. If you want to lightly occlude one and assess that one, and you can lightly occlude this one and assess the other. As I go down to his mouth, I'm going to ask you, open your mouth for me please, Mr. Bill. I'm going to be looking, first of all, at his oral mucosa to make sure that it is moist and it's not dry. You're also going to be looking for any sores to the back of his throat. You're going to be looking for any ulcerations, the presence or the absence of teeth, and whether or not the patient has any type of dentures. Okay. As I come down to his neck, I'm going to look for any jugular vein distension, making sure that everything is midline. You know, you have his trachea here, your larynx here. And then, too, I can go ahead and check his carotid pulses none, and you don't want to do them both at the same time. One thing I did want to go back and look at for his eyes. I'm going to make sure that his pupils are equal and reactive to light. If you'll look straight forward for me, please. I'm going to shine a light in your eye, okay? Okay. His pupils are round, and they react to light about a size 3, and the other does the same thing. Also, if I wanted to check for accommodation, what I would have you do is look at my finger, okay? Now I want you to look at the wall when I tell you, and then I want you to look back at the finger, okay? Look at the wall for me, and then look at my finger. Okay. All right, so as you're going down your systems, what you want to do is you want to make sure that as you're assessing the patient that you provide for patient privacy and make sure that he's covered as much as possible at all times. Also, if there are any family members in the room before you get the patient uncovered, you may ask them if they want to step out at this time. Okay, so I'm going to move this down some so that I can assess his chest. Okay. So the first thing I want to do is look at his chest and make sure that as he breathes, that his chest is rising up and down with, and it's equal on both sides. And he's breathing and not using any of his accessory muscles. As I listen to his lung sounds, take a deep breath for me. I want to make sure that I'm listening to the lateral lung sounds as well. You'll have some nurses who want to go ahead and get the patient to turn over and listen to the posterior breath sounds, but I like to do that all in the end. It prevents the patient from rolling back and forth multiple times, and that makes it easier on the patient. So, are you coughing any?
Yes, ma'am.
Are you coughing up anything?
No, ma'am.
Any shortness of breath?
No, ma'am.
Do you get really tired and fatigued a lot is it ever difficult for you to breathe?
No, ma'am.
Okay. So if he were coughing up any, if his cough was productive, we would document the amount of sputum, the color of sputum, and any of its characteristics. As we go look at his other extremities, I want to first of all check and make sure of their temperature, to make sure that they're equal temperature. Can you feel me touching you?
Yes, ma'am.
Okay. Can you feel my finger? What about right here?
Yes, ma'am.
Okay. Right there?
Yes, ma'am.
Okay. And we'll go ahead and assess the pulses while we're on this side as well. And then we'll feel for pulses here. And there. We'll check his capillary refill on his fingers. Your capillary refill, you're going to hold that down for a few seconds, and when you let it go, it should return back to normal within less than 3 seconds. Okay? Can you squeeze my hand? Tight as you can. This will assess the upper arm strength. One thing that we did do, that we forgot to do, were the heart sounds. And I'll go back and I'll listen to his heart sounds. I'm going to listen to the aortic. We'll listen to the pulmonic. We'll listen to the tricuspid. And we'll listen to the mitral. Here, listening for the characteristics lub-dub sound, listening also for any murmurs or gallops. Okay? While we're still focusing on the chest, we're going to note his abdomen. We're looking for any type of distension. And then also we want to ask him about, have you had a bowel movement?
Yes, ma'am.
When was the last time you had a bowel movement?
Last night.
It was last night?
Yes, ma'am.
Okay. Was it normal?
Yes, ma'am.
Was it a large bowel movement?
No, ma'am.
Was it a small bowel movement? Okay. Was it really dry and hard?
No, ma'am.
Was it really loose and watery?
No, ma'am.
Okay. Have you been passing gas?
Yes, ma'am.
Okay. Without any problems?
No.
How's your appetite been?
Good.
Okay. Well, that's good. You're eating good even with this hospital food?
Yes, ma'am.
Okay, well that's good then. What we're going to do is we're going to listen. After we inspect the abdomen, then we want to listen. It's very important that you auscultate the abdomen instead of palpating or percussing it, because you don't want to disrupt the bowel sound. And as we start here at the left lower quadrant, we'll move up to the right. Up to the left upper quadrant, over to the right upper quadrant, down to the right lower quadrant. You should hear vowel sounds every 5 to 15 seconds. Okay. Let's put his shirt down here. This is the portion where we would evaluate his GU area, and we'd ask a series of questions. About his urinary. In the real world, of course, we would definitely investigate those, the presence of Foley catheter, or we would investigate whether or not there are any lesions, any drainage, either from the penis or from the vagina. But for the sake of this video, we're going to bypass that. Okay, so we're going to roll these down. We're going to go to his extremities here. Okay. So what we're going to do is we're going to also check for warmth and sensation. Can you feel me doing that? Okay. We'll check pulses here, popliteal. We'll check the dorsalis the dorsalis tibial, and the posterior tibial. And the dorsalis pedis. Okay. We'll ask you, can you bring your leg out for me? What about back in, up, down, the other leg out, in, up, down. Okay, if he had hair on his lower extremities, we want to make sure that you have equal distribution of hair. This can let you know if there's any type of circulatory issues or any type of arterial occlusions. Okay, so I'm going to push against your feet, and I want you to push back as hard as you can. Again, we're going to be assessing his muscle strength in his lower extremities. Also, if your patient was able to walk or needed to go to the restroom, this would be a prime opportunity to help him up to the restroom to assess his gait, to make sure that everything with his gait is normal and his balance. So that is, I'll ask him now if he will. I'm going to let the head of the bed down. And we'll turn over to this side. Okay. And this is the part where I'm going to assess his backside. I like to do a complete backside assessment all at once. Then I'll listen to his breath sounds. Deep breath in, deep breath out. Okay. I'm also going to assess his spinal column, and we're looking for any curvatures or any type of scoliosis. And then stretch your legs out for me, Mr. Field. Then I would look at his backside to make sure there's not any breakdown all the way down. Make a careful note to look at his heels and indicate his pressure point, and everything looks fine. Roll that down for me. I'm going to get him covered up. Are you comfortable like this? You want to stay like this? You want to turn on your side or something? Okay, well let's turn on your side. Okay, here you go. Well, I'm going to go to the station and make a note of your assessment, and then I'm going to get your medicines together, okay? Is there anything else you need?
No, ma'am.
There's nothing else you need? Okay, well if you need something, then just go ahead and press your call light, and I'll be back to help you, okay?
Yes, sir.
All right, nice to meet you, Ms. Bill.
Nice to meet you, sir.
All right. And that is a head-to-toe assessment for NUR 6660. Thank you for your time.